Welcome to Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. It's Men's Health Month, so we're giving you the lowdown on what men should do to stay healthy. But before we get started, let's take a look at what's coming up on the show. The importance of getting the COVID-19 vaccine, maintaining your eye health with the latest technology, and we'll show you treatments for neuropathy. All that and more on this episode of Your Health. Men will typically put off going to the doctor far more than women, so during Men's Health Month, we're encouraging men to schedule their annual checkups. Joining me now to talk more about this is Dr. Frank Lavecchio, an ER physician with Valleywise Health. Doctor, thank you so much for being with us.
Erica, thanks for having me.
First off, doctor, tell us, have you seen during the pandemic that men are putting off their doctor visits even more?
The short answer is yes. The longer answer is we see more and more extremes of diseases. I work in the emergency department. I'm also a public health doctor. We see people putting off visits, which unfortunately leads to us seeing the bad sequelae of disease. We see heart attacks present later than they should. We also see strokes coming in a little later than usual. We also see people with abdominal pain coming in really late. There's a record number of perforated appendix, for example. So in short, men, even women, are putting things off more.
Now, doctor, why do you think men put off, going to the doctor?
Well, it's a good question. I think the short answer is, me being a man most of my life, I could say that we're very stubborn. There's a million reasons that we cite. Many of them is I don't have a doctor. I don't have insurance. They're going to find something wrong with me. We hear that a lot. Other reasons are financial. Unfortunately, with coronavirus, we saw a lot of people lose their jobs, and their jobs are directly tied to their health insurance. And because of that, they don't have health insurance. A lot of people say they don't have the time. And it's true, we are all extremely busy. I think you have to try to find the time for this. If we look for things early on, we can prevent things from being catastrophic.
What annual test should men be getting every year?
It's not one size fits all, but in general, the tests increase as you get a little bit older. We generally don't do prostate screening when you're very, very young, but prostate health is something that we look for. Of course, cholesterol screening. High cholesterol is associated with heart attacks and strokes. Blood pressure, checking your blood pressure, that's something that should be screened for. Colorectal screening. We also see more and more people getting depression screening. So those are some major ones.
Now, doctor, prostate cancer is the number one cancer in men. How important is it to catch it early?
Well, if you catch prostate cancer early means localized. Early means that it's just in the prostate, it hasn't spread. The 5-year survival rate is 100%. But if you go in and they find that it's spread to distant places, for example, prostate, perhaps it goes to some bones, okay, then the chances of you being alive at 5 years is 30%. Now, this is something that could have been caught earlier, as simple as a yearly checkup, as simple as a prostate exam, and sometimes they do blood testing.
Yeah, absolutely. So, doctor, any final advice to the men out there about their health? What would you like to say to them?
I would like to say that don't die of something that's easily preventable. And going from head to toe, think about easy things like, diet, exercise, controlling obesity, controlling your blood pressure, controlling your diabetes, getting checked for these things, getting checked for heart disease, getting checked for prostate health, getting checked for colon cancer. There are tests out there that they can do to see if you have a genetic predisposition for it, see if you're at risk for anything. And if you are at risk for anything, you keep a closer eye on things.
Dr. Lavecchio, thank you so much for being here with us. We appreciate your time. If you'd like more information, head over to their website. We've seen the positive impact of the COVID-19 vaccine, and the California Department of Health wants to educate the community about why we should take our shot.
The vaccines do a great job of teaching your body or teaching your immune system how to recognize and fight the virus that causes COVID-19. It helps to stimulate your immune system to produce antibodies that can fight off the real disease. So the vaccines, none of the 3 vaccines that are readily available to us actually have COVID, the virus in them. They just help our bodies recognize when COVID presents itself so that our bodies are ready to fight against it. So the vaccines are extremely safe. We've had millions of individuals that have received the vaccines, and these vaccines have gone through the most rigorous testing, gone through several phases of trials, and many patients and many individuals have received the vaccine without any side effects. So like many vaccines, there are some side effects, but most people do very well with them. The things that we tend to see most often, you may have a sore arm after receiving the vaccine. You may have some muscle aches. Some people develop fever or some mild body aches, but most of those symptoms tend to go away within the first 24 to 72 hours. So first day to 3 days. So for people who have pre-existing medical conditions, we often suggest that they are the first in line to get the vaccine because it helps protect them against the risk of having severe disease. So most people who have significant medical conditions should get the vaccine. But if you do have questions, or if someone does have questions, they should definitely talk with the healthcare provider. So as of today, we have received verification through the CDC and FDA that individuals that are 12 years and older can be vaccinated. There are distinctions as to which vaccines that they can receive. So those that are 12 to 17 can receive the Pfizer vaccine, and those that are 18 and older can receive the Johnson & Johnson or the Moderna vaccine. California has strict laws around how personal information is being used for vaccines, and California negotiated with the federal government to limit the required data to share to only information that will not allow an individual to be identified. So there are many different places where you can get a vaccine at this point. You can go to your local community health center where they're vaccinating patients and community members. You can go to local health organizations and pharmacies. And you can also look to myturn.ca.gov or call the COVID-19 hotline at 1-833-422-4255. So everyone getting vaccinated can help end the pandemic by protecting us against new variants, providing protection for the whole community. And with that, we have the power to end the pandemic.
If the man in your life snores, you may want to get him checked out by a doctor. Men who sound like a foghorn have a greater chance of developing sleep apnea, which can be dangerous to their health if not addressed. Stick around, here's what's coming up on Your Health. We get an eye exam with the experts at Stanton Optical, and how you can get outstanding care after a cancer diagnosis.
Diet, exercise, and healthy blood sugar levels are keys to an active lifestyle. Now you can support healthy blood sugar levels the easy way with Axelin. With a proper diet and exercise, just 2 Axelin tablets each day help support healthy blood sugar levels. And Axelin's available without a prescription. Promote healthy blood sugar levels the easy way with Axelin. Enjoy an active lifestyle with diet, exercise, and Axelin. Order today at Axelin.com or Amazon.
An annual eye exam should be a part of everyone's yearly routine, and at Stanton Optical, they provide all of your eye care needs with their state-of-the-art technology.
Stanton Optical is an optical retailer that provides eye exams and glasses for every budget. Stanton Optical came to San Diego in 2016. We started off with a store in Santee and have grown to 8 stores here in the county. At Stanton Optical, we offer a comprehensive eye exam. That means we don't skip any testing in order to give you the best exam possible. It is very important to have an annual eye exam to check and monitor the overall health of your eyes.
3, 2, 1, open up.
The first part is our pre-test, where our patient care specialist will take you through the exam using our state-of-the-art technology and equipment. The reason why we do so many tests is because we're looking for early stages of glaucoma, diabetes, macular degeneration, and cataracts. What separates Stanton Optical from other optical retailers is our extremely competitive pricing and our cutting-edge telehealth technology.
Maybe I'm gonna go ahead and have a seat.
Hello, welcome.
Hello.
A telehealth exam is a comprehensive eye exam that utilizes telecommunication technology to remotely communicate with the optometrist. This allows us to effectively and accurately provide an eye exam without direct contact with the doctor, ensuring maximum safety protocols. Customers are usually very impressed with the way that the eye exam has evolved. Our system, that is proprietary, was invented by Stanton Optical and solely used within our stores. Here at Stanton Optical, we follow all state and CDC guidelines. We require face coverings and temperature checks for all employees and patients. We practice social distancing by ensuring appropriate space between patients and employees. Face shields and dividers are also utilized throughout the store. All common areas and frames are sanitized after every transaction.
Those are very nice.
At Stanton Optical, we have thousands of frames, and our associates have been trained to find the right frame and style for you. We pride ourselves in making sure that you do look good before you leave the door.
Buy one, get the other one free.
Everything in our store is buy one, get one free. And as long as you make an eyeglass purchase, then the exam is included as well. And we do have promotions to accommodate almost any budget. With our buy one, get one free, you can choose any 2 frames that you wish, whether it be a clear pair, sunglasses, you need readers, or even safety glasses. It's all included. We offer a wonderful selection of safety frames with no additional fees. We also offer complimentary routine maintenance of your glasses. You can also see us with an outside prescription, and we accept most vision plans. To schedule your appointment, just go to stantonoptical.com and choose the location that best suits you. Come on in and we'll see you soon.
After a cancer diagnosis, you want to choose the best possible support and care, which is what the Moores Cancer Center at UC San Diego Health provides to their patients through their commitment to outstanding care.
Moores Cancer Center is the only comprehensive cancer center in San Diego, which has NCI designation, which NCI stands for National Cancer Institute. And this is designated to only the highest possible ratings for cancer centers in the country. And that means that it's experts in every medical subspecialty pushing boundaries for difficult to treat cancers. We have a unique blend of cancer research and patient care, which really helps us take care of the whole patient from bench to bedside interventions with the latest research, and we're really pushing the boundaries to treat each individual cancer as much as possible. We're very proud of our leadership here in the community at UCSD. We just got accreditation from the National Accreditation Program for Rectal Cancer, which really shows our multidisciplinary approach and that we're treating not just one cancer, but the patient, and that we're treating each cancer uniquely and that we're at high level in care. We recognize that no 2 patients and no 2 cancers are alike. And so we really feel that cancer care is as unique as you. So you as the patient, and we take each patient as an individual. We treat them as individuals. We really listen to their needs and concerns, create an environment that's healing with gardens and supportive environment. And so we really feel like we want to treat both the patient, mind, and body with the whole patient. We treat all types of cancers, from the common types to extremely rare cancers. Our physicians are setting treatment standards nationwide for more than 200 types of cancers. But the most important cancer that we treat is yours. And we also work as a multidisciplinary approach. So when you see one of our doctors, you're going to see all of the doctors that are treating your cancers: radiation oncology, medical oncology, and surgeons will all be on a team that work to treat your cancer. When we put in the time and care into our patients, they really appreciate it. They feel grateful when we take the time to really talk to them. I feel like they feel heard and feel like we're really listening to them and that we're helping them really beat this cancer diagnosis and helping them be stronger and feel better about the outcomes.
Make sure to always wear sunscreen. Melanoma cases among young men have been on the rise in the last few years, and it can be deadly. See your dermatologist once a year to check your skin. Here's what's coming up on Your Health: how you can ease the pain of neuropathy, and getting the help you need through counseling.
Don't let concerns about healthy blood sugar levels control your life. Take control with diet, exercise, and Axilin. Just 2 Axilin tablets each day help support healthy blood sugar levels. Axilin's key plant-based ingredients help your body process carbohydrates and fats. And Axilin is available without a prescription. Control your life and your lifestyle with diet, exercise, and Axilin. Order today at Axilin.com or Amazon.
It's estimated that about 30% of Americans will be affected by neuropathy, and the doctors at True Health can help your symptoms with their innovative treatments.
So neuropathy is actually more common than we think, and it is nerve damage. So there is over 100 reasons to why neuropathy happens. There is diabetic neuropathy, there is chemical and medication-induced neuropathy. There is also idiopathic, which means we don't know why it happens. But regardless of the reason, we need to know why it's happening and how to treat it. Over time, as these nerves are damaged, they cause patients symptoms like tingling, burning, cramping. Patients are not able to sleep. So with time, this can take a big toll on patients' quality of life. It's very important to treat neuropathy without medication because the medications are simply designed to mask the problems. So as we continue to mask these symptoms, they're just going to get worse. And a lot of these medications, they actually numb your brain, which means they numb the pain. They don't do anything about the root cause of the problem. Our most successful patients are ones that are highly motivated. They don't want the pill for an ill formula. We are the type of clinic that will work with people who are highly motivated to get better. In doing so, using these FDA-approved, groundbreaking treatment modalities, we're able to remarkably see patients do better. Our patients actually do really, really well, where we're able to see these symptoms go away because your body can heal. Your body can heal and wants to heal without medication.
Once the regimen was established, I felt comfortable with it, and I have shown nothing but marked improvement. When I first came in, it looked like this. Now that I'm completing my treatment, this is what I look like. Prior, I was experiencing neuropathy and cramps during the night. I couldn't sleep all night. Presently, I can sleep the whole night. I'm walking without a cane, and my quality of life has vastly improved.
So when our patients come in for nerve damage screening, we do a touch-based exam because these patients have been poked and pried so many times, so this is completely pain-free. This is one of our very severe cases, and you can see that because of the many areas that they have complete black. Black is total loss of function. You can see that just few short treatments later, they went from this to this, and this is how we know that they are actually progressing and then they're improving and their symptoms are going away. At True Health, we pride ourselves in treating all patients like family. So we bend over backwards for our patients when they come in here for treatments. They want to be here, they love coming here. We have a location here in Chandler, Arizona. We're also located in Scottsdale. And we are ready for you to come in, again, for that free exam and consultations where we can go over your symptoms, see if you make a good candidate for the treatments that we have. We are ready for you. Let's get your quality of life back. You have nothing to lose but your neuropathy.
Don't go away, we have more coming up on Your Health. Free counseling to help you cope with the stresses of life.
Your health is brought to you by Excellent. Take just 2 Excellent tablets each day to support healthy blood sugar levels the easy way. Order today at Excellent.com or Amazon.
Now you can support healthy blood sugar levels the easy way with Axelin. Just 2 Axelin tablets each day help support healthy blood sugar levels. And Axelin's available without a prescription. Order today at Axelin.com or Amazon.
Many people are still suffering with the impacts of the past year, but there is hope. Let's take a look at the Resilient Arizona Crisis Counseling Program.
Resilient Arizona is a critical service brought together in response to the pandemic and the individual social and emotional needs, the isolation that comes with the pandemic, and the fear, and really being able to provide a service and support for individuals to help cope with those and build resilience through the pandemic. So the Resilient Arizona program came about with an opportunity from the federal government to provide support for individuals impacted by the coronavirus pandemic. So the Arizona Department of Emergency and Military Affairs, as well as the Arizona Healthcare Cost Containment System, managed the program, and we're able to operate that through Solari Crisis and Human Services, as well as a collection of 6 community providers throughout the state. The services are available through Resilient Arizona statewide to anybody impacted by the pandemic that are struggling with some of the emotional challenges that can come along with coping with such a large issue and challenge affecting our community. The services are free and confidential, and they're available in both English and Spanish. The services for Resilient Arizona are provided in person, telephonic, or through a telemed video conferencing service.
Resilient Arizona provides the opportunity for residents to learn coping skills, to be connected to resources in their area locally to provide help beyond the counseling, and the counselors can help residents deal with grief, stress, anxiety, and many other things related to the COVID-19 pandemic. What people need to understand about their reactions to the pandemic is that no one has been through this before, so the things that they're experiencing are natural reactions to extraordinary events, and so helping people understand that often helps them cope with the situation better. Traditional mental health services treats diagnosed illnesses, whereas crisis counseling seeks to prevent the onset of diagnosable disorders. So basically people are learning how to cope with situations that they haven't been in before, and we're trying to treat people upstream before these situations and their reactions to them develop into mental disorders. When the crisis counselors are providing their services, they keep no formal records, and so this really is an opportunity to speak with someone completely anonymously if desired. Confidentiality is secure, and the services are 100% free. We invite anyone who is suffering the effects of the pandemic, be it depression, loss, grief, anxiety, stress, please reach out to us. We are here to help. While the counselor provider hours will vary, help is available at 211 Arizona in English and Spanish 24 hours a day, every day of the week. Simply dial 211 to connect with a counselor today.
Thank you so much for joining us on Your Health. I'm Erica Cardenas.